Headache behind the ears, causes and symptoms. There are several causes of headaches behind the ear. With proper medical treatment, these headaches can be relieved. A headache behind the ear refers to any point that originates from that specific area of the head. Though headaches themselves are very common, headaches that occur exclusively behind the ear are fairly unusual. This type of headache pain can have several causes, from nerve injury to dental problems. The cause of the headache behind the ear will determine symptoms and treatment. This video explores the signs and symptoms of headaches behind the ear and details what causes them. It also causes how they can be treated to relieve pain and the associated symptoms. Causes. There are several possible causes of a headache behind the ear. This include the following: occipital neuralgia. One of the most common causes of a headache behind the ear is a condition called occipital neuralgia. Occipital neuralgia occurs when the occipital nerves, or the nerves that run from the top of the spinal cord up through the scalp, are injured or inflamed. People often mistake sharp pain behind the ear to be the result of a migraine or similar types of headaches, as symptoms can be similar. People who suffer with occipital neuralgia describe the chronic pain as piercing and throbbing. They also describe it as similar to the feeling of receiving an electric shock in the following places: upper neck, back of the head, behind the ears. Occipital neuralgia happens as a result of pressure or irritation to the occipital nerves. It typically only appears on one side of the head. In some cases, the pressure or irritation may be because of inflammation, overly tight muscles, or an injury. Often, doctors cannot find a cause for occipital neuralgia. Mastoiditis. Mastoiditis is an infection of the mastoid bone, which is the bone directly behind the ear. This infection is much more common in children than adults and generally responds to treatment with no complications. Mastoiditis causes a headache behind the ear as well as fever, discharge from the ear, tiredness, and hearing loss in the affected ear. The temporomandibular joints are the ball and socket joints of the jaw. These joints can become inflamed and painful. While most people with TMJ inflammation feel the pain in the jaw and behind the ear, others may just experience a headache behind the ear. TMJ can be caused by stress, teeth grinding, arthritis, injury, jaw ailment. Symptoms. Symptoms of headaches behind the ear can vary based on the causes. Occipital neuralgia may cause intense pain to the back of the head and or upper neck. Often, it can start in the neck and work its way up to the back of the head. The episodic pain is like an electric shock to the back of the head and or neck. Signs of an infection such as fever or tiredness often accompany mastoiditis. People experiencing TMJ may sense jaw tightness and pain in addition to a headache behind the ear. Additional symptoms that people who suffer from headaches behind the ear may experience include pain on one or both sides of the head, sensitivity to light, aching, burning, and throbbing pain, pain behind the eyes, tender scalp, pain with neck movement. Home treatments. Treating the pain is the primary method of dealing with a headache behind the ear, unless a root cause can be determined. There are some at-home treatment options for people to try before or in addition to a doctor's care. Some at-home treatments include rest in a quiet room, over-the-counter anti-inflammatory drugs such as ibuprofen, which is also available to buy online, massage of neck muscles, apply heat to back of neck. Heat packs are available to purchase online. Reduce stress, stop teeth grinding. As with any treatment options, a doctor should be consulted before adding medications. Treatment of headaches behind the ear. When under a doctor's care, someone will have a treatment plan for headaches behind the ear that will include managing the pain and treating underlying causes of the pain. Depending on the exact cause of headaches behind the ear, a doctor may prescribe medications including prescription muscle relaxants, nerve blocks and steroid shots, physical therapy, antidepressants, anti-seizure drugs, antibiotics if mastoiditis is suspected, a night guard for TMJ. This may be purchased online, though consulting a dentist is recommended. Nerve blocks and steroid shots are often temporary and necessitate repeat visits to the doctor to be re-injected. Furthermore, it may be necessary to administer several shots before the pain is manageable. In rare cases, an operation may be required. Typically, operations are used if pain does not get better with other treatments or keeps recurring. Operations may include microvascular decompression. This procedure involves the doctor finding and repositioning the blood vessels that are compressing the nerves. Occipital nerve stimulation. A neurostimulator delivers several electrical pulses to the occipital nerves. In this case, the electric pulses may help block pain messages to the brain. No matter the treatments decided upon, it is important to rely to a doctor whether or not they are effective. In some cases, continued pain may indicate that it is the result of another condition which needs to be treated differently.